Joining us now, the Premier of Newfoundland and Labrador, Andrew Furey. Nice to see you, Premier.
Nice to see you, Rosie.
You talked to the Prime Minister yesterday, I understand. He talked to you and a couple of your counterparts out east. What did he want in terms of the kind of support that you could give this province, Ontario in particular, or other provinces?
So we chatted a bit about the situation in Ontario as it pertains to COVID-19 and the outbreak. And we have offered to the Prime Minister, as we did to Premier Ford last week, any support Newfoundland and Labrador could give in terms of personnel, equipment, supplies, within our own capacity, of course, recognizing that Newfoundland and Labrador is a small province, but we recognize the significant impact this is having on Canadians living in Ontario, and we want to be able to help.
Have you been able to identify what that support would be? Because you're right, it's a small province, so I wouldn't imagine you've got a lot of excess there.
No, but I mean, from my previous life, I've seen how a small province can give back on an international stage. Sometimes the medical relief comes in small packages, but makes a big impact in local communities. So, having a group of organized medical professionals to go in and help in these COVID units and critical care units would be an incredible asset for the people of Ontario, and that's what we're trying to organize right now here on the ground. And frankly, the support that I'm receiving from emails, texts, from former colleagues within the healthcare system, and of course in the NGO system that I worked in before, has been quite remarkable.
Well, people probably don't know all the details about what you're referring to there, Premier. You are a doctor, and you have in the past, I believe, set up field hospitals in Haiti. You've done work in other countries trying to support them in crisis moments.
That's right.
Yeah. So what from that experience, what have you been able to assess you might be able to do for other parts of this country?
Well, I think in terms of the personnel in particular, we have, we're very lucky here in Canada to have incredibly talented medical professionals from coast to coast to coast. And Newfoundland's no different. And so we would love to be able to provide some personnel, even if it's in a relief capacity. I imagine that your healthcare professionals are working just tirelessly, which is one of the lessons we learned after the earthquake in Port-au-Prince. You go in and you help the system. It allows for some relief for the people who are working, 24 hours a day, 7 days a week, nonstop. So we'd love to be able to provide some personnel in that respect, medical expertise, not to change anything because we're such a small unit, but again, small units can make a big impact when you're dealing with a crisis like this, and that's certainly something that I've learned from my international work.
So you did speak to the Premier last week, and now you've spoken to the Prime Minister. What was the response from Premier Ford? Was he anxious for you to start ponying up some people? What was the response?
No, I mean, Premier Ford and I have had a great relationship, and I can understand he's going through a very anxiety-provoking time right now, a very anxious time for him as the leader of the province and for everyone who's living in the province. I get that. We went through something not as big as the outbreak that you guys are having, but certainly something that was quite stressful for our citizens here in the province, and you could hear it in his voice. I mean, he's incredibly empathetic to the people on the front lines and to the citizens of Ontario, and I believe he's trying to make the best decisions with the evidence available to him now. It is at a critical point, and he was quite open about having an exchange of whatever, again, with what limited capacity we have here in Newfoundland and Labrador to be able to offer help.
It kind of blows Canadians' minds, though, I think. Well, I'll speak for Ontarians, that a small province like Newfoundland and Labrador is helping the biggest province, or that we're at that stage in Ontario, that the third wave has become that bad. And I appreciate you're friends with the Premier, but some would suggest that it is as bad as it is because public health measures were not put in place sooner. And perhaps it's Ontario's problem to fix. What would you say to that?
Yeah, no, I mean, I don't see COVID-19 as recognizing any provincial barriers. I think that this is the beautiful thing of Canada. This is the benefit of a federation, when you can call on your neighbors to help in tough times. And Newfoundlanders and Labradorians have always stepped up in tough times, a crisis, whether it's here or abroad or throughout Canada. And we intend to help here now. There'll be plenty of time to do a post-mortem on COVID-19, and I'm sure there'll be volumes of books, medical and otherwise, written on what has done well and what has not been done well. But how we got here right now is somewhat irrelevant. The point moving forward is how we get out.
What about vaccine supply? Is there any consideration to forego some of your vaccine in order to get it to hotspots in the country?
Yeah, right now we're still working on the per capita model, and what's happening in Ontario right now. I was saying to my cabinet and staff the other day, you have a forest fire. You need firefighters. You don't need the fire prevention unit. You need the fire fighting unit. And of course, we all know that even if you had all the vaccine right now at this particular moment, there's a 10 to 14 day immunity uptake before you're able to have an impact. So this kind of you're in the steep part of this curve, and this is where you really need to flatten the curve. Ontarians can have a significant ownership over this and flattening the curve by following these public health measures and dealing with the hospital issues that exist currently. So, we're moving forward with our per capita based calculations and plans here in Newfoundland and Labrador right now.
I want to ask you a budget question before I let you go, if I can, because it is the first one in 2 years tomorrow, and we are expecting significant spending and stimulus in the form of things like a national childcare program, perhaps long-term care. Is your province interested in a childcare program? Would that be helpful, or are there things that you would prefer to see that would be better for your province?
We're very much, absolutely, in short, we're very interested in a child care program, pharmacare, long-term care. We're interested in partnering with the federal government to see where that can go. We're also kind of curious to see where some of this green infrastructure programs or money and funds are going to be spent, especially with respect to our ability to be a green battery here on the East Coast with excessive wind, as we all know, hydroelectric capacity. We have an ability to really be the green battery that can drive the East Coast of Canada, and we're interested to see where that goes. But with respect to your first couple of programs, we've already done $25 a day child care here within our first 6 months taking office, and I'm interested in moving that number down. So I'm very much interested in seeing where the federal government is on a pack funding or partnerships with respect to early childhood care and development.
Okay, Premier, good of you to make the time on this Sunday morning. Thank you, sir.
Well, thank you so much. Stay safe.
Yes, you too. Thank you, sir.